Let's bring into the conversation Dr. Peter Hotez. He is Dean of the National School of Tropical Medicine at Baylor College of Medicine and co-director of the Texas Children's Hospital Center for Vaccine Development. He also is the author of the book, Preventing the Next Pandemic, Vaccine Diplomacy in a Time of Anti-Science. Dr. Hotez, good morning. It's great to have you with us. Let me start with the booster. This is something that you and other experts have said was coming. What have we learned about this virus and about this vaccine that now requires a booster shot at this point?
Well, what we're seeing, Willie, is a decline in effectiveness of the vaccine. And a lot of the studies are coming out of Israel, one out of the Mayo Clinic, showing that against infection, the effectiveness of the vaccine has gone down from over 90% to 40 to 50%. So far, it's keeping up pretty well in terms of keeping people out of the hospital. But I think the worry is that with that decline from 90 to 40%, which is a pretty significant decline, that's the tip of the spear, and we'll start seeing a pretty precipitous rise in hospitalizations among vaccinated individuals. And we're even hearing anecdotes from physicians that 10-20% of their hospitalized patients are vaccinated. So, it's not too surprising given the fact that, when we rolled out these vaccines, they were only given a 3 to 4 week interval between first and second dose. That's how the phase 3 trials were done. And that was done for a very good reason. If you remember back in December and January, we were losing 3,000 American lives a day, and there was a crisis. And so we had to get people fully immunized in as quick a time as possible. And it made sense, and it actually saved a lot of lives. But the trade-off was, by doing that short interval, 3 to 4 weeks, you get a big decline in durability and length of protection. And so in some ways, that kind of sealed the deal that this was going to be a three immunization vaccine.
And we've got a large population in this country, people under 12, children who are not even eligible for the first shot of the vaccine. You've been sounding the alarm about what may be ahead this fall because of that. What should we expect as we look toward the school year? Some of the country is back to school, a lot of it is not yet. What do you see on the road ahead?
Well, right here in the South where I am, things are looking pretty grim. Even before school has opened, for instance, Houston Independent School District opens in a few days on August 23rd, we're already seeing a lot of kids and adolescents and young people go into the hospital and even pediatric intensive care units, which we've never seen before. And the fact that, a lot of the leaders of the executive...
Everybody, look at the difference here. You see the teacher in the N95 and the face shield? You think they're wearing this N95 and face shield just to protect the children? No. They're also wearing this to protect themselves. Listen to the news with your eyes.
The executive leaders of states here have blocked any kind of mask mandates, and certainly nobody's talking about a vaccine mandate for the 12 and up, which is ridiculous. Of course we should do that. So we've really set up our kids to fail. So we're already seeing schools open, saying that just ignore all that stuff, we're going to be fine. And then they close up a few days later because there's so much COVID. And I don't see how things go differently, unfortunately, in the South. So nobody put policies in place to ensure that our kids could successfully complete in-person learning this fall. And all they did was stamp their feet and say no mandates without putting policies in place to protect our kids.
Dr. Hotez, how far away are we from that vaccine for children 12 and under?
I think we'll definitely head there later in the fall.
Under 12.
I don't know that we'll have it by the end of this year. I'm hoping we do, and that will make things a little easier as well. But again, if you look, here in the South, fewer than 25% of the adolescents, or 12 to 17-year-olds, have been vaccinated. And I would imagine among the younger kids it's going to be even worse. So essentially none of the adolescents are vaccinated here in the southern part of the United States. So we have this, it's not even balkanization, it's too big for that. It's the whole southern part of the United States is in defiance against vaccines, and it's having such a self-defeating effect.
Dr. Peter Hotez, Baylor College of Medicine. Dr. Hotez, always great to have you on the show. Thanks so much. Joining us now, the Surgeon General of the United States, Dr. Vivek Murthy. Dr. Murthy, it's great to have you with us this morning. Let's go back a step and talk about those booster shots and why you think they're necessary.
Well, good morning, Willie. Yesterday, we made an announcement that we plan to start offering booster shots on September 20th to people who are at their 8-month anniversary from their last shot. The reason this is so important is because what we've seen in the data. We've seen, number one, that your protection against the worst outcome of COVID, hospitalizations and deaths, if you get vaccinated, still remains high. But we're erosion and protection against mild and moderate disease. And our collective judgment is that that erosion, if it continues, may in fact mean that more people are at risk of hospitalization. We want to act ahead of the virus. We want to make this plan now so we can ensure protection from the vaccines is extended. And that's the goal of the booster program.
And as you say, I think most doctors and most public health experts like yourself saw this coming, that there would at some point be a need for boosters. I'm sure you've heard some of the criticism from the WHO, particularly the chief scientist, who said these are not necessary at this time, that we should get the most vulnerable people around the world vaccinated before we start going into boosters. How do you answer that?
Well, look, I personally think it's incredibly important that we look not just at the United States, at the world, and the administration believes that as well. Look, we know this is a global pandemic. We know that unless the world is vaccinated, we will continue to see the development of new variants, and that will affect us in the United States. So I don't see this as a choice that we can afford to make between America and the world. We have to do both. But when we see evidence that immunity is waning, especially in the face of this dangerous Delta variant, and when we are projecting based on our best clinical judgment that they may start to erode the protection against hospitalizations and death in the future, we have an obligation to act to protect people here at home, just as we have an obligation to continue accelerating our efforts to produce vaccine for the rest of the world, and we will do both.
Thank you. Stay safe, America.